right, Doxin, and we're talking about chronic pain. And I was just thinking, when you're hungry, you kind of know that feeling. Mm-hmm. And, it's the body telling you something. You're hungry. And you run and you get yourself some food. Right. Chronic pain, it's the body telling you something, isn't it?
Right. Something is wrong. Mm-hmm. Pain is like your check engine light on your car, telling you there's a problem.
You've oftentimes said that.
Right. It's telling you something is wrong. Now, you wouldn't take a brand new car that you just saved up 2 years to buy, and if the check engine light comes on, put tape over it so that you couldn't see it.
Right.
And a lot of times...
You wouldn't drop some Motrin in the gas tank.
Correct. And so people have a tendency to treat their cars better than they do their own health. And so pain is your body telling you something is wrong, and it's not normal. It doesn't matter if it comes and goes. Sometimes patients will say crazy things like, well, yeah, I have that, but it only happens, 2 or 3 times a week. It's not a big problem. I feel like saying, well, if the brakes on your car stopped working, but it was only 2 or 3 times a week, would that be a problem? Yeah. Or if your refrigerator, if you got up and your refrigerator wasn't working, but it was only twice a week, would it have a problem?
Right.
And so, yes, these things are a concern. Wow. Now, the secret to our drug-free pain relief program is that we've put together the top 4 things that have the absolute best results and are backed up by bulletproof research. And we've put these 4 things together in one treatment protocol. And here's why this is so cool, is because we battle pain, chronic pain, on a multi-frontal assault, almost like a multi-pronged approach. Now, the reason that that's so effective is because people will often try one thing and they'll get little or no results and they'll move on. Now, imagine if I do these top 4 things to solve your pain, and they each help by 20%. Mm-hmm. I've just reduced your suffering by 80%. Wow. Yeah. So we don't have to hit the magic bullet. We don't have to find that one thing that's going to, solve all of your problems. But if we find 4 things, and each one of those 4 things can help your pain and reduce your suffering by 20%, we've gotten you almost 100% out of pain. We've gotten you 80% of the way there. And I guarantee you, if you ask chronic pain patients, if I could get rid of 50% of your pain, would you consider that a success? And most of them say that would be a miracle.
Yeah.
And so these things are tremendously successful. Now, to go over some of these new technologies, and the first one that's part of this 4-step process is one that I had mentioned a few months ago and that I received my credentials in. And it's a new procedure that we've been doing called integrative dry needling. You guys remember that from a few months ago?
Yes.
And I've been doing this now for several months, and I can report to you that just like the clinical data suggested whenever I got my credentials, it's one of the most effective treatments that I have seen for pain and muscle spasms in almost the 18 years that I've been in practice. This is a tremendously successful procedure, and it's been so successful that it's taken up a very large part of my practice in the last 3 months. And we have people travel from all over Louisiana to get this treatment with us, and so it's truly been a miracle for many of our chronic pain patients. And just real quickly, the way integrative dry needling works is, you see, whenever tissue becomes painful, it doesn't matter what it is, if it's a shoulder, wherever, when tissue becomes painful, the body's response is to contract or tighten the tissues to protect the area. This is called splinting. Now, by the way, this is why you grab your elbow when you hit it, or you grab your thumb after you smash it. That's called splinting. That's your body's protective reflex or protective mechanism. And it actually takes place throughout our whole body. When an area becomes painful, the tissues contract around it. Now, when these tissues contract, the blood gets pushed out of those tissues. But the problem with that is that the blood contains all of the oxygen, all of the healing chemicals, all of the white blood cell, all of the healing cells, and the blood also washes out the painful waste products like lactic acid and carbon dioxide out of the area. So when a body becomes chronically painful and the tissues contract through this splinting mechanism, adequate blood doesn't get to that area to cause proper healing. No oxygen, no healing, no washing out of the waste products, and no exchange of those healing chemicals. So when an area gets chronically painful, it pushes the blood out. It gets more chronically painful, causing worse tightening and less circulation. And then the spiral continues of pain, contraction, less healing, more pain. This is why your chronic pain has not gotten better. In fact, it slowly loses its ability to heal or get better. And so I can now reverse this reflex, this splinting, by creating a little tiny lesion in the tissue with a very little small acupuncture needle, and the body will now recognize this and open the blood vessels, rushing new blood and oxygen and washing out all of the waste products and promoting new healthy cells to grow and replace the damaged tissue. So this will cause the chronic tissue to finally begin to heal because it rushes blood and oxygen and healing chemicals and cells, and it washes out all the lactic acid and waste products out of that area.
It sounds like a similar process to what a lot of women do for facials. They get a laser treatment, and it kind of irritates a little bit, so the healing is promoted. Is that similar?
Yeah, right. And it turns bright red when they do that.
Interesting.
Yeah, same thing with this. It brings blood to the area. Now, in fact, speaking of laser, that's also one of the top 4 that I'm going to go through in the next show. Yeah, so laser is a very important thing for this type of thing as well. But this promoting of these new cell growth and replacement of these damaged tissues and bringing oxygen and new blood and washing out all the waste products out of this area begins the process of healing in chronically inflamed tissues. And so this is just one of our one tool of our new chronic pain program. We really have a 4-step program of things that are just remarkably effective. And I can tell you that our program is really unlike any other. It's one of the most effective programs that I've ever seen to help folks finally be themselves again, live their lives feeling good, do what they enjoy with their kids and grandkids. You know, one of the saddest things I do is whenever a patient comes in and sits down and tells me all the things they're not doing because of their pain. Well, I used to go dancing, but we had to stop doing that. I used to do my gardening. Well, I used to be able to lift the grandkids. Well, I can't play in the yard with the kids anymore. And that's called adaptation. Pretty soon they just adapt themselves out of everything that it has to do with enjoying life.
Yesterday, Deb and I had a friend visit, and she was saying that she no longer sits in low chairs that are low to the ground. She sits in a high chair to accommodate the problems, if you will, with her body. And I was thinking, wow, that doesn't seem right.
Don't let yourself adapt out of doing things that you enjoy. Helping people enjoy their lives is really what has kept me doing this day to day for the last 18 years. So, you know, I'm so fortunate to be able to play such an important part in changing people's lives. It's one of the things that gets me up every morning. So I wanted to invite all of you to register for our open house to hear and see for yourself how these 4 new technologies might help you or someone that you know. It's going to be on August the 28th at 7 p.m. Everybody's invited. And as always, you can call my office to register. It is 837-7174 in Lafayette. That's 837-7174. And also, we're going to have the same thing in New Iberia. It's 367-2567 in New Iberia, or they can join us on Facebook at the Bryant Wellness Institutes. And guys, listen, if you're out there suffering, even if medication makes it better, if you're interested in hearing about some new solutions outside of traditional medicine and how effective they have gotten now, you don't want to miss this workshop. And, you know, if your spouse is suffering, drag them to the workshop. You know, a lot of times as men, we want to put it off until we just can't hardly walk. And so, you know, if your spouse is suffering and putting it off and, you know, taking handfuls of medication every day just to get to work and back to the recliner, encourage them to come. And if they won't, you come for them. You know, this is something that these solutions have such hope for people out there that suffer with pain.
All right, Doc. Thank you.
Thank you, guys.
Dr. Kevin, Wellness Wednesday on KTDY.